My dear students, you wanted to know about the adverse effect of corticosteroid. The main adverse effect of corticosteroid, if we use prolongedly the oral and the injectable corticosteroid for several weeks, it may causes turn into a symptom that is called iatrogenic Cushing syndrome. This iatrogenic Cushing syndrome is due to the excessive synthesis of glucocorticoid from the adrenal cortex, and these excessive glucocorticoids may lead to hypercortisolism, and for a prolonged period of time doctors are given for any disease where there is indication of steroid. This steroid is given prolongedly for a few weeks, and these turn this patient into iatrogenic Cushing syndrome. What are the features of iatrogenic Cushing syndrome? If we see the face of the patient, there will be moon face, there will be plethoric face, there will be puffy face, and there will be edematous face. In iatrogenic Cushing syndrome, the blood sugar level of this patient may rise. There will be hypertension, there will be peptic ulcer disease, there will be osteoporotic change. If we go through the symptoms of this patient, if we describe it just like this, that if we see the face will be puffy, the face will be edematous, the face will be called moon face and maybe plethoric face. If we measure the blood sugar level of the patient, there will be hyperglycaemia, and there is increased chance of diabetes mellitus for this patient. In case of GIT, there will be peptic ulcer disease in the kidney. There will be sodium retention, and that causes edema in dependent part of the body. This in bones there will be osteoporotic change. There will be hypercoagulopathy, there will be delayed wound healing, there will be thinning of the muscle become atrophied and muscle bulk become loss. In iatrogenic Cushing syndrome, there are some features. There will be electrolyte imbalance due to hypercortisolism. Hypercortisolism has some mineralocorticoid activity. This mineralocorticoid activity turns into reabsorption of sodium. There will be Hypernatremia, there will be hypokalemia, there will be hypokalemic alkalosis, and sometimes we called it metabolic alkalosis. Why these symptoms occur so fast and easily developed in this patient? Why these symptoms are developed? In hypercortisolism, we know where there is a excessive cortisol level, the cortisol level increase the blood glucose level by neogluconeogenesis and glycogenesis. Where there is neogluconeogenesis and glycogenesis, the blood sugar level will be rise, and insulin is released to compensate the blood sugar level, but it cannot act like that and can't compensate this hypercortisolism induced hyperglycemia. When the insulin comes, insulin try to fight to compensate the blood sugar level, but it failed. Another thing is insulin is an anabolic hormone. It causes lipogenesis, and there will be more lipid synthesis, and that's why atherosclerosis may occur. And this more lipid causes peripheral utilization of the lipid in the face, in the back, in the shoulder, and there will be a buffalo hump, pendulus abdomen may occur. And there will be atherosclerotic change, and this atherosclerotic change may causes anytime there will be myocardial infarction, there will be unstable angina, there may be angina pectoris, or sometimes stable angina may present of this patient, and there will be another feature of hypercortisolism in case of iatrogenic. There will be hypercoagulopathy, there will be delayed wound healing, and there will be immunosuppression over there. When there is total immunosuppression, any bacterial and viral infection may occur. There will be very much chance of pneumonia in the lungs, and there will be chance of oral candidiasis. There may be chance of rise of Helicobacter pylori infection in GIT, and due to local immunity suppression in the GIT or stomach, there will be The overhand of the Helicobacter pylori may cause Helicobacter pylori associated peptic ulcer disease. There are lots of features in iatrogenic Cushing syndrome. Why the muscle bulk become lost while the muscle become atrophied. These occurs due to in hypercortisolism causes protein breakdown. That is much protein breakdown from the muscle mass, and the muscle protein breakdown causes muscular thinning, muscular atrophy, muscular loss of muscle bulk and loss of muscle power. And sometimes the osteoporotic change is due to hypercartilism may induce stimulate the osteoblastic activity, and there is the inhibition of the vitamin D synthesis, so no calcium will be absorbed from the bone, and calcium reabsorption causes bone loss of calcium and fragile bone, and there may be breakdown of the bone causes pathological fracture. In the CNS, the hypercortisolism or iatrogenic Cushing syndrome may induce psychosis, may induce depression, may induce insomnia of this patient. There are lots of features of hypercortisolism, iatrogenic Cushing syndrome that I described. If you miss anyone, you can ask in the next class. I think these are the features of iatrogenic Cushing syndrome. So if we again tell that what are the features of iatrogenic Cushing syndrome, in face there will be moon face, there will be buffalo hump, there will be pendulous abdomen, there will be hyperglycemia, there will be a hypertension, there will be peptic ulcer disease, there will be osteoporosis, there will be muscle thinning, there will be muscle atrophy, there will be avascular necrosis of the hip, there will be increased bacterial and viral infection, there will be hypernatremia, there will be hypokalemia, there will be metabolic alkalosis. These are the features of iatrogenic Cushing syndrome. So hypertension is an important feature of iatrogenic Cushing syndrome. Where there is hypercortisolism, their pathway may tends to increase the aldosterone synthesis, and when there will be aldosterone synthesis, there will be increased rise there will be renin-angiotensin aldosterone system may be activated for aldosterone synthesis. When there will be renin-angiotensin aldosterone system activated, there will be produced angiotensin 2. This angiotensin 2 causes vasoconstriction, and there will be rise of blood pressure. And in another sense, aldosterone may causes sodium reabsorption in the kidney, and this sodium reabsorption may tends to causes edema over the dependent part of the body, and not only edema, it causes if there is any patient developed hypertension, there will be a chance of heart failure. So these are the important features of iatrogenic Cushing syndrome, and you should remember. And in examination Viva board, there is an important question: what is the adverse effect of steroid? If you go through like this, you can tell any answer from this. Okay, thank you. Best of luck.